Pathway to Excellence is a premier designation that VA Providence Healthcare System has achieved for its third time in a row. It is an accreditation by the American Nurses Credentialing Center, and it shows that our facility has nursing excellence where nurses have a voice, patients are provided with the best care, and that we are offering evidence-based practice in a shared governance structure.
And our nurses are empowered here to utilize that voice to make process improvement changes and influence the care that the veterans receive.
You know, through our Pathway to Excellence journey, we've always held the belief that all staff voices matter all the time.
Our nurses are encouraged to be part of their unit practice councils, as well as part of the shared governance committees that allow them to share their voice up from the direct care nurses all the way up to the nurse executive leadership.
It's important for nurses to have a voice because we're the frontline staff. We're the ones that are at the bedside. We notice when there's a safety issue. We notice when there can be a process improvement to improve the care that the veterans receive that lead to better outcomes for the veterans.
So the staff are very vested. They know that what they do matters every single day. They know that they make a difference. And I think that may differ from working in maybe other type of organizations where it's about numbers or it's about bottom line. And for the VA, it's never been about that. It's always been about giving back. It's always been about supporting veterans and also taking care of our staff.
So I actually work on a floor where it's an outpatient unit, but we administer a lot of chemotherapy, and we were empowered, and it came from the direct care nurses where we developed an SOP to improve our practice in administering chemotherapy. And again, that came from the direct care nurses with the support of leadership. So it improved our practice, and it also improved the outcomes of the patient because we were practicing within evidence-based guidelines.
And within my role, nurses are able to come to me at any time and discuss with me any concerns they have or any variations in practice that they're able to identify. And from there, I can work with the nurse directly to pull literature, look at different practices throughout other VAs in the country, and identify if our process needs to be improved upon. And I am able to guide that nurse through the shared governance process so they can make change. And through that, it's very empowering because you can see a nurse learn and grow in this process and able to see change that's implemented based on their early identification of a problem.
Just recently, we reviewed some of our joint patient safety reporting data. We've had a 25% increase in reporting over the last year, and I think that just shows our commitment to empowering and encouraging the staff to bring forward concerns.
Being a nurse at the VA Providence Healthcare System is an unbelievable honor. I feel valued every day that I'm here, and I love what I do and continue to feel as though I'm serving a purpose greater than myself. And it's a great achievement and a true accomplishment to be a part of this organization.
As a direct care nurse, I have the confidence to speak up, and I know I can make change, not just at the floor level, but throughout the organization. And to feel that support makes me want to continue within my professional development and impact the care that I give to our veteran population.
I don't think I can overemphasize how incredibly proud I and the rest of the executive leadership team are of our nursing staff. Every single day we get great feedback from our veterans about how grateful and how thankful they are for the care they get from our nursing staff every single day. I think our Pathway to Excellence designation shows our commitment and their commitment to a positive practice environment, and it truly is an honor to serve them every single day.
Being able to ensure that not only the veteran, but their families are taken care of is a great honor and privilege.
And caring for veterans gives us a sense of purpose and lets us feel a part of something that's bigger than just us. Contributing to the care of our nation's heroes is an incredible honor and something that we don't take lightly here. It's pretty great.
I think people become nurses because at their core, they care for others. And to care for our veteran population, I don't believe there is a group of people more deserving of nursing excellence and that ability for people to care for them, for people that have given so much for this country.